background. This meeting is being recorded. So for those who can't be with us today, you can still view it on our AARP YouTube channel. When you see the meeting recording, please click Got It. If you're not familiar, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people to choose how they live as they age. AARP works to strengthen communities and advocate for what matters most, with a focus on health, security, financial resilience, and social connection. Now, today's program will focus on Medicare and enrollment. Who's in the audience today, Jacqueline? Who do you see in the chat?
Oh, we have a cross section of the nation, fortunately. We have Paula from Asheville, North Carolina. We have greetings from Dolores in Dallas, Texas.
Oh,
We have Lena from the Bay Area.
all right.
We have Annabelle from Walnut Creek and another Annabelle from Tucker, Georgia.
Woo.
We have Gloria from Atlanta. And we have Jerry from right here in California. We have Centerville, Virginia represented.
Wow, all right.
Full cross section of everybody wanting to enjoy the information from this program today.
Oh, thank you so much, Jacqueline, and thank everybody for joining. We're delighted to have all of you join us today and hope you have your coffee, tea, or other beverages with you. We are excited to share you with Medicare basics and enrollment. But before we get started, we do want to share our disclaimer. This session is intended to be informative and educational and does not constitute insurance or Medicare enrollment advice. Please consult Medicare.gov or your insurance company for advice regarding your personal situation. AARP is not responsible for the consequences of any decision or action taken in reliance upon or as a result of information provided during this event. But please note, all information will be placed in the chat. So to get us warmed up today, we have 2 poll questions, and we ask you to quickly submit your answers. Our first poll question is, do I need to contact Social Security before enrolling in Medicare? What do you guys think? Oop, that is coming in. Yeah, it's really rolling in. What do you guys think? Do you need to contact them or not?
It slowed down a little bit.
I did, huh? Okay, so far I see 70% says no, 58% is saying yes, and again, 34% is saying I'm not sure, but I guarantee you, you will know everything that's going to be going on at the end of our meeting. So let's go to number 2, poll question number 2. And the question will be somewhat similar to the first question. It says, do I
only
need
have the poll question 1 up.
Do I need to renew Medicare every year? What do you guys think? Do you need to do it every single year? It's a good question. And if you're not for sure, don't worry about it, because you'll learn it today. The answers are coming in.
We have a lot of people who are going to really just share their information or what they think they know, which is terrific.
Yes, isn't that good, Charlene? Oh my God, it's so cool. So far we have 53% is saying yes. 100%, well, 106 is saying, definitely no, we have to do that again. And again, 22% is saying, well, I'm not for sure, but like I said, you will know a little bit later on today what's going to happen. So get your pens out, because now you can start taking notes. So it's my pleasure to introduce our returning guest speaker, Charlene Wall. Charlene is a retired kindergarten teacher living in St. Louis, Missouri. And she was born in Missouri many years ago when there was an Air Force base in Kirksville, Missouri. And she'll tell you a little bit more about that. Charlene loves to present programs as she learns something new every time she presents it, whether it's the driver's safety, safety drivers TEK, or one of the many topics for the Speakers Bureau. She was taught AARP's St. Louis exercise classes during the pandemic online. Can you imagine teaching a class online during the pandemic? Exercise classes? That's so cool. Now, Charlene is the 2021 State of Missouri's Address Award winner, which is AARP's highest rated honor. And she is particularly proud of this honor. And it also meant a donation was given to her favorite charity in St. Louis, LiveWise Senior Companion Program under the umbrella of AmeriCorps. Now remember, please put any questions for Charlene in the chat, and she will try to answer them during the Q&A portion of our program. But before we get started, as per our tradition to add some fun spice to her introduction, let's find out a little bit more about Charlene. Now, Charlene and her husband walks 3 miles every morning and befriended and learned the names of all of her furry neighbors. Can you believe that? 3 miles and talking to furry neighbors? She is an avid crafter, and she never dies. She could never die because she has too many craft projects ahead of her. Charlene has perfected her mother-in-law's recipe for banana bread. Now it's Charlene's famous banana bread. Wow, let's welcome Charlene.
Thank you so very much. Let me start sharing my screen. If I'm capable of this, we'll see. Okay, I think I'm on the correct spot. Am I presenting properly?
You're there.
Anybody?
You're there.
Terrific.
Come on.
Okay. During this session, we're going to talk about a few things: the Medicare basics, Medicare choices that you have, Medicaid and other programs that may be able to offer some support for you, and most importantly, resources and tools as you start your adventure with Medicare. As I am a volunteer with AARP, I can't provide advice for your personal situation, but I can recommend different people or different places to talk to. The resources will be listed in the chat, and if they're not in the chat, because we're having a little bit of problems getting them there, there's so much information, they will be in a follow-up email that will come directly to you as well. All right, let's begin with the beginning, the basics. What is Medicare? Medicare is a federal health insurance program for individuals, number one, who are 65 years and older, number two, for some younger people with certain disabilities, and number three, for some people with permanent disabilities, end-stage renal disease, and people with ASL, or Lou Gehrig's disease. Medicare is for United States citizens and or permanent legal residents who have lived in the United States for at least 5 years. Regarding the term disability, Social Security defines disability as being unable to do the work you're used to do because of a condition that is expected to last for at least a year or to result in your death. You must also be unable to do another kind of work, even with accommodations. Remember, it's an individual program, no spouse, no personal family members, or new group insurance. It's for individuals. Original or traditional Medicare parts involves Part A, hospital, Part B, medical, and is often referred to as original or traditional Medicare. Part D is optional, but it is what you need if you want a prescription drug covered that are on original Medicare. Medicare Advantage is also known as Medicare Part C. These Medicare plans are offered by private insurance companies and typically include Parts A, B, and D all under one plan. We'll discuss specifics later. There is so much to cover. Like most insurance, Medicare does not pay for all of your healthcare costs. You're responsible for paying for the costs that are not covered, such as your monthly premiums, deductibles, coinsurance, or copayments. And let's define those terms. A premium is the monthly amount that you pay to Medicare or a private insurance company for your health care and your prescription drug coverage. A deductible is the amount you owe for the health care insurance services your health plan covers before your health plan begins to pay. The deductible may not apply to all services. Coinsurance is the amount you may be required to pay as your share of the cost for services after you pay many deductibles. Coinsurance is usually at a percentage. A copayment is the fixed amount that you pay for covered health insurance services, usually when you receive that service. The amount can vary by the type of covered health insurances you have. These terms are something that we're all familiar with as we were in the workplace, and we see these in regular, normal insurances. They're the same responsibilities for Medicare. Medicare does not cover long-term care, vision, dental, in most cases, hearing, such as extended care in a nursing home. Medicare Advantage plans may cover these, but traditional Medicare does not. We'll get into the differences between original or traditional Medicare and Medicare Advantage in a moment. Medicare does not pay for stay in a long-term care facilities or the cost of any custodial care, that is help with activities such as daily life, bathing, dressing, eating, and going to the bathroom, except for very limited circumstances when the person receives home health care services through a Medicare-approved agency. Please note that these rules can be quite complicated. We're going to go over it only at a very high level. The situation may also differ depending on whether you have original Medicare, Medicare Advantage, or a Medigap policy. In a skilled nursing facility, what does Medicare cover? If you're enrolled in original or traditional Medicare, Medicare Part A can pay a portion of the cost for up to 100 days per benefit period in a skilled nursing care facilities or a skilled or SNF, which are most nursing homes, if you continue to meet Medicare's requirements under specific limited circumstances. A daily skilled nursing or rehabilitative care is ordered by a physician, and the care cannot be just custodial, personal care such as bathing and dressing. You must be admitted to the Medicare qualified skilled nursing facility within 30 days to qualify of a hospital stay for the same illness or injury or condition related to it. You're going to ask me now what a benefit is, and the benefit period is, it begins on the day you're admitted into an inpatient service or a hospital or a skilled nursing care facility, and it ends with a hospital stay at 100 days or a skilled nursing care facilities at 30 days. There's a qualifying hospital 3-day stay rule. Qualified hospital stay means that you must have been admitted as an inpatient for at least 3 consecutive days. Observation status does not count. The day you are admitted does count, but the day you are discharged does not count as one of those days. Additionally, time spent in the ER does not count. When you enter the hospital, ask if you are being officially admitted for or observation. If the latter, you may want to appeal your doctor's decision and ask if you can be switched into inpatient status. With Medicare Advantage plans, which match the coverage of original Medicare and often provide additional benefits, you often don't have the same restrictions for enrollees. Check with your plan provider on terms for skilled care nursing facility. Skilled nursing facilities are only one places that have to abide by the rule. If you are discharged from a hospital to another kind of facility for ongoing care, such as a rehabilitative hospital, Medicare provides coverage under different rules. What original Medicare pays is, if you're qualified for coverage in a skilled nursing care facility, Medicare pays 100% of the costs, meals, nursing care, room, for the first 20 days. For days 21 through 100, you bear the cost of the daily coinsurance, which is $200 per day in 2023, which does change yearly. If you remain in the skilled nursing care facility longer than 100 days, you are responsible for the full cost unless you have additional insurance, such as a Medigap plan, that will cover it. No, the average stay for a Medicare patient is about 23 days. Now that we've gotten an overview, a very high overview of Medicare, how it works and what it doesn't cover, let's dive into what it does cover and learn more about the different parts of Medicare and your choices. You may have heard of Part A, B, C, and D. Let's break it all down, starting with Part A. We're going to learn about each part of this, but we're going to talk about a quick overview. Again, original or traditional Medicare covers Part A, hospital, Part B, medical, and are often referred to as original or traditional Medicare. Part D is optional, but it is what you need to have a prescription drug coverage if you are on original Medicare. You also may have heard about Medigap policies. Those are supplemental insurances for those who have original Medicare or traditional Medicare. Medicare Advantage is known as Medicare Part C. These Medicare plans are offered by private insurance companies and typically include Part A, B, and D all under one plan. They do, a Medicare Advantage plan also is different in each state, so you need to find out what those plans include and what plans are offered in your state. Medicare Part A is hospital insurance. It helps cover inpatient hospital care, some home health, hospice, and some skilled nursing care facilities. To qualify for hospice care, a hospice doctor and your doctor must certify that you are terminally ill, meaning that you have a life expectancy of 6 months or less. When you agree to hospice care, you are agreeing to comfort care, palliative care, instead of care to cure your illness. You also may be asked to sign a statement choosing hospice care instead of other benefits Medicare covers to treat your terminal illness and related conditions. Medicare certified hospice care is usually given in your home or other facilities where you live, like a nursing home. Original Medicare will still pay for covered benefits for your health problems that aren't part of your terminal illness and related conditions, but hospice care will cover most of your care. You pay nothing for hospice care. You pay a copayment, of $5 for each prescription for outpatient drugs for pain and symptoms. Let's talk about some of the out-of-pocket expenses for Part A, starting with Part A premiums. Most people who qualify for Medicare don't pay a premium for Part A because they've already paid through their payroll taxes while working. If you do not have a premium-free Part A, you may be able to buy it under certain conditions. Part A has coinsurance in addition to a deductible. There is a deductible of $1,600 in 2023 for inpatient costs for each benefit period. And that it will change every year. It can change every year. The benefit period ends when you haven't gotten any inpatient hospital or skilled care in a nursing care facilities for 60 days in a row. If you go into a hospital or an SNF rather than after one benefit period has ended, a new benefit period is ending. So what that means is when you go into the hospital, that begins your benefit period. When you enter or leave a hospital or skilled nursing care facilities, it ends and a new benefit period begins. After you have satisfied your deductible, you have no coinsurance for days 1 through 60. Then you pay $400 per day for days 61 through 90, and $800 per day for days 91 and beyond up to the 60 additional days. The 60 additional days are considered a lifetime reserve and may be used a few days at a time for hospitalizations that may last more than 90 days, but for no more than 60 additional days in a lifetime. If a hospital should approach 90 days, whether it's better, you may decide whether to use your lifetime benefits or reserve them for another time. Medicare Part B coverage is medical insurance. It helps cover medically necessary items or preventative services. Medicare, medically necessary services are services or supplies that are needed to diagnose or treat a medical condition and meet accepted standards for medical practice. They may include things such as doctor's visits and e-visits, outpatient hospital services such as x-ray or same-day services, durable medical equipment such as wheelchairs, walkers, hospital beds, and CPAP machines, and mental health services and rehabilitative services. Preventive services include healthcare to prevent an illness like the flu or detect it at an early age, when treatment is most likely to work best. This includes tests, screening, wellness visits, and assessments. Costs. We will review cost on the next slide. But in general, for medically necessary services, you usually pay 20% of the Medicare approved amount, and Part B deductible will apply. You pay nothing for most preventative services if you get the services from a healthcare provider who accepts assignment or who accepts payment, which is pretty much every doctor. If you are enrolling in 2023, which I know that's not for most of you, your premiums for this year are $164.90 per month. Those with higher incomes, individuals earning more than $97,000 a year, or couples earning more than $194,000 a year, will pay premiums based on their income. The annual deductible for Part B in 2023 is $226 and coinsurance of 20% of most services. This is an important point. If you do not sign up for Part B when you first are eligible, you can face a monthly late enrollment penalties for life. I want to repeat that because it's awfully important. If you do not sign up for Part B when you are first eligible, you can face monthly late enrollment penalties for life. In general, you would only delay enrollment in Part B if you or your spouse are still working and are covered by employer's insurance. COBRA insurance does not count, nor does a retirement plan. Employer has 20% or more employees. Until this enrollment or with the health insurance ends, whichever comes first, you either end your employment or you end your coverage of insurance. If this describes your situation, speak with your employer's benefits administrator to discuss what is best in your situation. Medicare Part D coverage, which is responsible for drug coverage, helps you cover some of the cost of prescription drugs that you may pick up at the pharmacy. Recently, AARP led the fight to lower prescription drug prices and won. Millions of people now save money on their medications. The new CAPS law for Part D prescription drug coverage, beginning in 2025, the beneficiaries will not have to pay more than $2,000 per year. Drug makers who increase the price of a drug more than the rate of inflation will be penalized. The law also caps the out-of-pocket for insulin at $35 for a month. Out-of-pocket costs for most vaccines under Medicare will be eliminated. Medicare Part D is provided by standalone Medicare prescription plans that only cover drug coverage only, and by Medicare Advantage plans that offer coverage for both prescription drugs and health care. Part D plans are run by Medicare-approved private insurance companies. To get a Medicare prescription drug coverage, you must join a plan run by an insurance company approved by Medicare. If you are eligible to join but do not, there could be a late enrollment penalty. Again, I'm going to repeat that because it's awfully important. If you are eligible to join but do not, you could face a late enrollment penalty. Qualified drug plans may be included in some retiree health insurance plans, like the federal government, and they do meet the Part D requirement. Medicare Part D, which is a prescription drug coverage, helps cover some of the cost of prescription drugs. Again, you pick up at the pharmacy. Let's talk about the costs for Medicare Part D. The benefits and cost vary among plans. There is typically a monthly premium, co-payments, and deductibles associated with Part D, unless you qualify for assistance of paying for these costs. As with Part B, premiums for Part D are higher for individuals earning more than $97,000 a year, or couples earning more than $194 a year. For 2023, the standard benefit for Medicare Part D includes a $505 deductible. After meeting the deductible, you are responsible for 25% of your covered Part D prescription drug costs until your total spending reaches an initial coverage limit, which for 2023 is $4,660. I'm sure you've all heard of the donut hole. The donut hole refers to the coverage gap between a Medicare drug plan. Over the last few years, the hole has been closing, and in 2020, the donut hole technically closed for both brand name and generic drugs. Based on what we've seen so far, cost sharing may still increase once you have reached the compared cost during your initial period. Many Part D plans require flat co-payments. For example, $45 during the part of the benefit that falls between the deductible and the coverage plan. However, once people reach the coverage gap, usually all plans switch to requiring 25% co-insurance, a percentage of the drug cost that is based on negotiated prices with the drugs. Unfortunately, for people who are on expensive drugs, that 25% co-insurance is often considerably higher than the flat copay amount they are paying before entering the coverage gap. The coverage gap in Part D prescription coverage begins once your total drug costs exceed a certain amount and before they reach the catastrophic coverage amount. For 2023, the donut hole or coverage gap starts after you and your plan have paid $4,660, and catastrophic coverage starts when you paid $7,400. In 2023, you will pay 25% of the cost of brand name drugs and 25% of the generic cost in a donut hole. It's important to note that exactly how much you pay out of pocket for each drug while you're in the donut hole will widely depending on the Part D plan you've chosen and the price your plan is negotiated with the insurance companies that manufacture your drugs. When your total out-of-pocket expenses for drugs on your plan's approved drug list reaches $7,400, you only pay a small co-insurance percentage or co-payment of covered drugs for the rest of the year. Your out-of-pocket expenses include your deductible, co-payments, and co-insurance. However, it does not include your Part D premiums. Please remember that resources are being dropped in the chat, and if you can't find them in the chat, they will be sent in an email after. So that don't worry about any of your resources listing; they'll be in a page sent to you. Now that we have an overview of the basic parts of Medicare, let's dive into your Medicare choices. There are two main options on how to get your Medicare health coverage. Original Medicare, which is known as traditional Medicare, has Part A and B, and you want a prescription drug coverage, you must join a Medicare prescription drug plan Part D. If you don't join a Part D plan initially and you don't have drug coverage, but then want to join it later, you will incur a fee. Medicare Advantage is known as Part C. These Medicare plans are offered by private insurance companies and typically include Parts A, B, and D, all under one plan. You may also have heard about a Medigap policies. Those are supplemental insurances for those with original Medicare or traditional Medicare. Let's go over those options. Original Medicare, also referred to as traditional Medicare, is a fee-for-service health plan. Original Medicare consists of Part A and Part B and covers mainly, but not all, of your healthcare costs. It generally pays 80% of what your covered medical expenses after you pay your Part B deductible. Because Medicare does not cover all of your healthcare costs, some people may consider a Medigap policy. You can only get a Medigap policy if you have original Medicare. You cannot get a Medigap policy if you have an Advantage plan or a Part C. We'll discuss those plans in just a moment. People with Medicare, original Medicare, and traditional Medicare can go to any doctor, hospital, or other healthcare provider who accepts Medicare, which includes about 95% of the physicians. If you have original Medicare and you want to get a Medicare prescription drug coverage, you must choose and join a Part D prescription drug plan. Because Medicare does not cover all healthcare costs, some people elect to pursue a Medicare supplemental insurance plan, sometimes referred to as Medigap. Medigap is a private healthcare insurance that helps pay for healthcare services that original Medicare doesn't cover, such as your deductibles, coinsurance, and co-payments. Medigap is only available with those people who have chosen original or traditional Medicare. It does not work as a supplement to Medicare Advantage plans. Insurance companies in most states can offer up to 8 standard Medigap plans for new enrollees. Each one offers a different level of benefits to fill different gaps in financial coverage and varies in price. All Medigap policies must cover hospital coinsurance for Medicare covered hospital stays, and Medicare coinsurance on your doctor's bill and all other Medicare Part B services. Medigap policies are different in each individual state. You need to choose one that is acceptable in your state, and you can find those in your resources. Individuals may purchase a Medigap policy within 6 months of enrolling in Part B. If you forget to enroll during this program, this time period, the insurance company will be able to charge you more and even offer you to refuse coverage. More importantly, if you choose a Medicare Advantage instead of original Medicare with a Medigap, your ability to purchase a Medigap plan in the future may be limited. All we're saying is if you choose a Medigap, you can have a Medigap plan with original or traditional Medicare, and you must choose a Part B. You must have Part A and B. If you choose a Medicare Advantage plan instead of original Medicare, your ability to purchase a Medigap plan in the future may be limited if you decide to go back to original Medicare. You pay a monthly premium for a Medigap plan. Medigap policies do not cover the cost of prescription drugs. They do not cover additional benefits such as hearing, dental, or vision. Now let's talk about your options with Medicare Advantage plans. As I mentioned earlier, Medicare Advantage plans may also be known as Medicare Part C. Medicare Advantage plans are private health insurance plans offered as an alternative to original or traditional Medicare. They are provided by Medicare-approved private insurance companies. To be eligible to enroll for Part C, you must first enroll in original Medicare, Part A and Part B. You will continue paying your Part B premium along with any premium your Medicare Advantage plan may charge. All Medicare Advantage plans must include Part A and Part B, and in most cases will include prescription drug coverages, Medicare Part D. As I mentioned in the last section, be aware that if you choose Medicare Advantage instead of original Medicare with Medigap, your ability to switch to a Medigap plan in the future may be limited. Additionally, if you have original Medicare with a Medigap supplemental policy and you switch to a Medicare Advantage, you may not be able to get a Medigap policy if you decide to switch back to original Medicare. Medicare Advantage plans are available in most parts of the United States, but you must live in the area to receive services, whether it's Puerto Rico or in your individual state. You must choose from the plans available in your area and sign up directly. The state's insurance plan actually dictates what insurance plans are offered in each individual state. Medicare Advantage plans pay for the same healthcare services as its original Medicare, but they also might include additional healthcare services such as vision, hearing, and dental. For most Medicare Advantage plans, you can go only to their doctors, specialists, and hospitals that are on the plan's provider list. Plans may also limited coverage or provide no coverage at all for out-of-network providers. You must also follow the insurance company's rules, such as required a referral before you get to see a specialist. So make sure you understand how Medicare Advantage plans work before you join. Make sure you study your state's plans very carefully, because they usually offer, with each state usually offers 4 to 5 plans, different plans. If you have a Medicare Advantage plan, your out-of-pocket costs depend on things like whether the plan charges a monthly premium in addition to your Part B premium, and some plans do, whether your plan has a yearly deductible or any additional deductibles, how much you pay for each visit or service, meaning you pay co-pays or coinsurance, whether you follow the plan's rules, like using providers in the plan's network. For example, if you seek services outside the plan's network of providers, you will likely have to pay more. And finally, whether you need extra benefits and if the plan charges for them. But remember, all of these amounts are determined by the private insurance companies that runs the Medicare Advantage plans. So costs will vary depending on each plan, and they may change each year on January 1st. Okay, let's do a quick quiz. Just think about it yourself. Don't raise your hand. Don't worry. How can you compare Medicare Part D plans or Medicare Advantage plans? Some of your options are sort through the mountains of mail you receive in the mail. B, ask relatives and friends which they prefer. C, identify the plan with the lowest monthly premium. Or D, use the plan finder on Medicare's website, medicare.gov, or ask a Medicare customer service representative to use it for you. The answer, of course, is D. Use the plan finder under Medicare's website or call to help, which that number is 1-800-633-4227, again listed in your resources page, to see the cost and benefit details of each plans available in your area, anonymously and with no pressure. Every plan is different, so it's essential to compare their details, identifying the one that meets your best needs and your preferences. The plan finder can automatically determine what you would pay out of pocket for your prescription drugs under any plan. It also tells you how plans stack up against each other in terms of quality. For example, customer service. This is planned by a 1 to 5 star rating services, and it identifies with the warning icon plans that have received fewer than 3 stars over a 3-year period. In addition, the Medicare website and toll-free number, there are other free and neutral sources that you can use, such as the State Health Insurance Assistance Program, SHIP, and Medicare Rights Center. The SHIP number is 1-877-839-2675, and the Medicare Rights Center is 800-333-4114. Again, these services are in your resource listing. So don't worry about having to write them down or if I've said them too quickly. How do I enroll in Medicare? Well, its initial enrollment is what we're going to talk about now. For most people, you're already receiving Social Security at the age of 65. You automatically will be enrolled in Parts A and B, and that was in our poll question. So I'm going to repeat that. For most people, if you are already receiving Social Security at age 65, you automatically will be enrolled in both Parts A and B. If you are not already enrolled in Social Security, be sure to enroll in Medicare during the 7th month period based on your birth month. 3 months before, 3 months after, plus 1 month of your birth month. Let me describe it a little bit easier. You can enroll in Medicare 7 months based on your birth month. You can enroll 3 months before you turn 65, 3 months after you turn 65, and plus the bonus month of your birth month. So there's a total of 7 months you can apply. If you do not enroll in Parts B and D when you are eligible, you will face financial penalties later when you do enroll. So it's important to adhere to the timelines. One exception to this is if you have coverage through your employer or your spouse's employer plan through a company with 20 or more employees. When you sign up for Medicare determines when your coverage starts. Beginning in 2023, if you sign up for the month you turn 65, coverage starts 1 month after you sign up. 2023 has the implementation of the Bennis Act. Thanks in part to AARP's advocacy, coverage gaps that are being eliminated. Medicare is implementing the Bennis Act, which greatly reduces the up to 7-month-long wait for coverage that people can experience if they sign up for Medicare during the general enrollment period or in the later months of their initial enrollment period. Beginning in January 2023, Medicare coverage will begin the month after your enrollment. There are 2 types of enrollment periods to be aware of. Open enrollment for Medicare Advantage and Medicare drug coverage is from October 15th to December the 7th of each year, where you can join, switch, or drop a plan. Your coverage will begin on January 1st. As long as the plan gets your request by December 7th, you can change from original Medicare to a Medicare Advantage plan and vice versa. Switch from one Medicare Advantage plan to another Medicare Advantage plan. Join or switch to a Medicare Part D drug plan. Or drop your Medicare drug plan coverage completely. Medicare Advantage open enrollment period from this is Medicare Advantage open enrollment from January 1st through March 31st each year. I'm going to repeat that. Medicare Advantage open enrollment is the period from January 1st to March 31st of each year. If you are enrolled in a Medicare Advantage plan, you can switch to a different Medicare Advantage plan or switch to Medicare Original and join a separate Medicare drug plan once during this time. What can I do? If you are enrolled in a Medicare Advantage plan with or without drug coverage, you can switch to another Medicare Advantage plan with or without drug coverage. You can drop your Medicare Advantage plan and return to Medicare, straight original Medicare. You also will be able to join a Medicare drug plan. What can you not do during this time? Switch from original Medicare to an Advantage plan. Join a Medicare drug plan if you are in original Medicare. Switch from one Medicare drug plan to another drug plan if you're in original Medicare. So the enrollment time between January 1st and March 31st really reflects only Medicare Advantage plans. So do be aware of that. During these periods, be sure to review your annual notice of changes during the updated Medicare and You Handbook, which now is becoming, you can ask for it either by physical copy, but they really want you to get it online, and they will ask that question of you. Depending on the circumstances, you may want to make changes. You can compare changes on Medicare.gov. You may also be able to find free information and events online or get help from the health insurance counselors that are in your area, like your State Health Insurance Assistance Program, shiphelp.org. Then that information will be on your handbook. You can also make changes to your Medicare Advantage and original Medicare prescription drug coverage when certain events happen in your life, like if you move or lose other insurance coverages. These chances to make changes are called special enrollment periods. Rules about when you can make those changes and the type of changes you can make are different for each period. When you are transitioning from an employer-sponsored healthcare coverage, you will have an 8-month special enrollment period, which provides the opportunity to sign up for Part A and or Part B. This program starts 1 month after your employment ends or the month after your group health plan insurance based on your current employment ends, whichever comes first. So if you have insurance through an employer or your spouse's employer, then and it ends, then and there you have a special enrollment period. Before we move on, I want to pause and just share some important information about protecting yourself against Medicare fraud. And I'm sad we have to talk about this, but we do. When you receive your Medicare, either through the mail or online, guard your Medicare card like it's a credit card. Medicare will never contact you or for personal information or ask you for your Medicare number. So don't, unless you've given permission in advance. Medicare will never call you to sell you anything. You may get calls from people promising you things if you give them your Medicare number. Do not do it. Medicare will never visit your home. Medicare can't enroll you over the phone unless you call them first. Check regularly for a Medicare billing fraud. Review your Medicare claims and Medicare summary notices for any and all services billed to your Medicare number that you do not recognize. Report anything suspicious to Medicare. If you suspect fraud, call 1-800-MEDICARE. AARP's Fraud Watch helpline is also a great source for questions about reporting fraud and scams. The toll-free number is available Monday through Friday, 7 a.m. to 11 p.m. Eastern Standard Time, and is 877-908-3360, and translation services are available. But again, all this information is on your resource list. Let's take just a moment to discuss Medicaid and other programs that can offer support. So we're switching from Medicare to Medicaid and other plans. If you have very limited financial resources, Medicaid may be your only option. Medicaid is a joint federal and state program that helps with medical costs for those people with limited income and resources. Medicaid offers benefits not normally covered by Medicare, like nursing home care and personal care services. Medicaid is the largest payer of nursing home care in the United States. Here are some quick facts about Medicaid. Coverage varies from state to state. You must meet strict financial and functional ability criteria to meet long-term care services under Medicaid. Some states use Medicare medical criteria as well. Every state must provide nursing home care to eligible people. Facilities must be certified by the government to serve people with Medicaid coverage. To some extent, each state provides in-home and community-based services as well. However, many states have a long waiting list for these services. Some states allow people Medicaid to decide what services they want to receive, goods and services that best meet their long-term care needs. They may hire family members or friends to provide the needed care. Most states allow long-term care recipients to keep about $2,000 in cash and other assets, not including their home and a vehicle. But there are important provisions about financial protection for spouses and dependents, estate recovery, and transfer assets. Each state has different rules about eligibility and applying for Medicaid. Call your state Medicaid program to see if you qualify and learn how to apply. You can also get this information on Medicaid.gov. So if Medicare doesn't cover what you need and Medicaid is not an option for your situation, where else can you get help? Government programs offer many services that can help you. These provide home-delivered meals, transportation, caregiver support, and help with household chores. There are disease prevention programs. You may want to investigate disease prevention programs such as the Alzheimer's Association, the Diabetes Prevention Program, and others that deal with long-term chronic conditions. Some of these groups offer support and limited services. There are also faith-based programs. If you are a member of a faith-based community, services such as friendly visitor or assistance with transportation or errands may be available. However, in many communities, there are waiting lists for support or only limited services available. If you have a specific question, excuse me, about your Medicare benefits or your plan, the place to go is medicare.gov. Make sure it's medicare.gov because that indicates it's a federally supported program. Or you can call Medicare directly at 1-800-633-4227. Again, all of these on your resources list. If you have questions about choices of your plans, you can also visit the website for the State Health Insurance Assistance Program, SHIP, shiphelp.org. This website lets you find free counseling and assistance with your local community and your local state. The great thing about this program is that they will sit down with you and offer you to help compare plans side by side that will fit your health needs. Remember to get the most out of your Medicare coverage. Review your benefits to learn what Medicare covers and what it does not. For those approaching Medicare initial enrollment period, AARP's new Medicare Enrollment Guide can particularly be helpful. The Medicare Enrollment Guide is a self-paced online tool designed to help you get personalized answer to your most pressing questions about enrolling in Medicare. This interactive guide provides step-by-step directions on what you need to do and what you need to consider when it's time to sign up for coverage. You can find that at aarp.org/Medicare enrollment, a terrific tool. Another great resource with AARP's Medicare Resource Center. Again, find it at aarp.org/Medicare. Thank you for joining me. I know there's a lot of information, but this is just the first place for you to start when you're looking at Medicare basics, the Medicare choices that you have in your community or your state, Medicaid and other programs, and the resources or tools. This really is your responsibility. I've just given you a high level look at Medicare and Medicaid. So do visit medicare.gov. I'm sorry, it's medicare.gov. And if you're exploring, checking out different plans, SHIP Help is another terrific sources. Again, all of these are in your resource guide, which should appear. I'm going to stop sharing, and I will ask the question if someone is going to.
Well,
I'm sorry.
my goodness. Thank you so very much,
Go ahead.
Charlene. This information was so valuable. I'm so excited. I'm glad you was here, and especially since open enrollment has begun. So let's go over the chat. Jacqueline, there's so many questions over the chat.
Oh
Pick
my
a few.
goodness.
Some of this you may have touched on, but I'm going to ask the question. One lady asked, how do I know if my husband's disability qualifies him for Medicare before the age of 65?
So get in touch with Social Security, and they would be able to answer your questions. Actually, even if you're still working, you need to get a Social Security account, which is terrific. It'll give you all that information and give you notices and notices when and information that you need to have. So socialsecurity.gov is a great place to start. You also might be getting notices by mail or by email, but pay attention to those. They will give you what Social Security will be able to offer you through Medicare.
Another question, moving to Santa Cruz, California, I have been told that the doctors there are no longer accepting traditional Medicare. They require us to join a Medicare Advantage program. What can we do?
I don't think that's allowed. I think they cannot do that. What I would suggest you do is if you have a physician that you like, which everybody has different physicians. I like the physician I've been going to for the last 20 years. The day he retires, I'm going to have to die, I think. He's not going to be there for me. Call your physician and say, hey, are you accepting Medicare still? I find that really hard to believe because there's an average of about 95% of physicians and services are will cover Medicare because we are the oldest, largest population and we are growing in numbers. So it behooves a physician to accept Medicare. I find that hard to believe. Someone may be misinformed.
Yeah. Is D only available through a third party, or can that be purchased as an option from original Medicare?
That's part G is in George.
D is in dog.
D is in dog. Okay. You can purchase which one you want. You can, when you have Medicare Part D, in the state of Missouri anyway, I have 5 different choices for my drug care coverage that are approved by Medicare. Again, each state has different policies and different plans that are offered, whether it's Hartford or Blue Cross. Each state depends on that. You can choose your own. And again, if you get in touch with the AARP or SHIP, they can compare apples to apples so that you can decide what's best for you. Maybe you don't need a high level prescription plan. You're not on a bunch of prescriptions, or maybe you need one that is higher because you're on more expensive drugs.
So if we are on COBRA, we should apply for both Part A and Part B?
If you're on COBRA, you can't be on Part A or Part B until you are off of COBRA. But get into Social Security, get an account with socialsecurity.org, and it will be able to tell you when you are eligible to apply for Medicare Part A and B. Usually COBRA usually isn't open-ended. Usually it's for a period of time, and I think it's 18 months that you're allowed. So after that time, you can look into that, but it's usually 18 months. But you can choose to stop COBRA at that time, at any time, and go to Medicare A and B. You just can't be on them both.
We sold our house this year. We have been told that our Medicare premiums will go up due to the large capital gain. This is a one-time occurrence. Can we get an exception for this 1-year increase?
You will not have, that's not correct. That is misinformed. And I encourage you to go to aarp.org tax aid. They will provide you with that information, because no, just because you've sold a house does not have any effect on your Medicare rates. What does affect your Medicare payments is if you made either below a certain amount or above a certain amount during your working career. The house has nothing to do with Medicare. They're misinformed.
Well, ladies, I have found it difficult to locate Medicare Part D formularies online. Can you give some insight into that?
I would hope. If you have a plan already, if you have a Part D plan already, you should be able to communicate directly with that drug company, that drug prescription company, and ask the question. Another thought is, wherever you get your prescriptions, ask the question of the pharmacist or the aide there, if there is a better place, because sometimes getting your medicines month by month is more costly than getting a 3-month supply. And you may also ask for a generic drug rather than a copyrighted drug. I hope that answers.
Are deductibles per person or per couple?
Individually, per person. And with Medicare, you have your own plan separate from your spouse. Also, I have actually a different drug plan and a different Medicare plan, Medigap plan than my husband, because we have different needs. So it's by individual, not a group plan at all.
Yeah. So let's say you use your Part A coverage limits for care in an eligible facility for 60 days, and then you are released. If you need in-care again, do you have a waiting period before you qualify for in-care benefits again?
It's a 3-day rule. They want you to either come back within 3 days or not. It is, different states have different rulings on that, but they don't want you to go home a day and then come back the next day, because that starts a whole new period. It tells the doctor in Medicare that your care was not complete. And you can also appeal those decisions. If you are released and you do not feel you are ready, or you're questioning that, you can get in touch with SHIP, and they will actually appeal that decision for you. They'll walk you through that process. Just because you're released by your physician doesn't mean you don't have resources if you don't feel you're ready.
You talked about the Medicare premium that we have to pay based on our income. I've heard that Medicare looks back 2 years to see how much your annual income was and assesses your premium on that amount. Is that correct?
It's 10 years. They'll look back 10 years.
Ooh. Oh, so they
So
do
hopefully you didn't make that much of an increase.
Okay. Medigap plan doesn't sound very attractive. Why wouldn't you sign up for Medicare Advantage? I don't know why you would sign up for Medigap.
Okay. That's a very good question because it depends on what you need. If you have a Medigap plan, you are confident that everything you need to have is covered through Medicare. Now, a Medicare Advantage plan benefits in that it will cover everything that Medicare, traditional Medicare covers, and may cover transportation, food, dental, and vision. So it depends on what your needs are. If you decide on a Medicare Advantage plan when you first enroll in Medicare completely, you will not be allowed to come back to original Medicare. So everyone, even SHIP, will encourage you to join straight Medicare first, get a Medigap plan to cover it, and then after your first year, look at a Medicare Advantage plan. Then you can go back and forth depending upon your needs, because you may need transportation, and it doesn't bother you that you would have to switch to a physician that the Medicare Advantage plan offers you. Or you may say, you know what, I like my doctor, I'm not leaving him.
My wife is younger and still working. I turned 65 in February 2024. Can I register for Medicare but delay without being penalized while I stay on her insurance until she retires in a year or two? That's a good question.
Exactly so. And what you need to do is you need to first register with Social Security. That's your first place to start, is Social Security. And then, yes, because you can't have both insurances. You cannot, if your spouse is working, that insurance is the one you have to follow through. When she retires, then you can both go to Medicare, or you can go to Medicare. You can also be on Social Security. Excuse me. You can also be on Medicare without being on Social Security. But the first place to start enrolling is with Social Security. So start there, and then you can fill out, you can go follow the blocks.
Can I enroll?
This will be our last question because it's so many questions. Ooh, and I don't want to cut you off, but I want you to at least get this last question in. Go ahead, Jacqueline.
Can I enroll in Medicare while still enrolled in an employer health insurance plan?
No. It's that simple. If I can just make just one last comment.
Yeah, sure.
This information may seem really complicated, but once you start doing your research, and once, I know this was just a high level glossing through in just a short time. Once you start doing your own research within your own state, you will find that it's really not that complicated. Just pay attention to the due dates and look, this is the first time you're looking at things, at this information. But again, start with socialsecurity.com because socialsecurity.government, because you cannot be enrolled in Medicare unless you are enrolled in Social Security. You don't have to be accepting it. You just have to be enrolled in Social Security. And I wish the man from Social Security were here because he could explain it better than I can, I'm sure. Thank you.
Actually, he is here, and he
Oh,
wanted
terrific.
to. Yes, and he was making some statements. Let me see if I can't really. 2 seconds. Let me just grab Guillermo. Hold on 1 second. Guillermo, hang tight. I'm
Terrific.
gonna hang on, Guillermo. Okay. Guillermo, are you there? Can you hear me? Guillermo, can you hear me? I don't know if he can hear me. He was here. Wait, there he is. There he is.
Hello, can you hear me?
Yes, we can hear
Great.
you.
Okay, great. Charlene, I don't want to take any of your time. Is it okay if I give out some information about Social Security and Medicare?
It's all up to you. You're on.
Great, great. Thank you. Good morning and good afternoon, everyone. This is great to be invited to a forum like this that's available nationwide, right? I was listening in the beginning where there's people from all over the country. This is great. What a great opportunity to be able to give information about Social Security and Medicare. I'm speaking a little bit fast because I have a little bit of time. I don't want to take too much of your time, but I wanted to give information on Social Security's relationship to Medicare. I'm a public affairs specialist with Social Security. I've been with the agency now for 24 years. I'm located in the Los Angeles area. So good morning again and good afternoon to everybody. I just wanted to share a little bit of information. Charlene did a great job of giving you the overall picture of Medicare. I just wanted to share a little bit more information regarding where to go, right? Medicare.gov is great. And as Charlene mentioned, Social Security is where you go to apply for Medicare. So this is our website. It is socialsecurity.gov. If you were to click on the blue box there where it says Medicare, there's a drop down that shows you about planning for Medicare or applying for Medicare. Also in the middle there where it says apply, right below that, there's a red box that says sign up for Medicare. That is where you can directly sign up. So you don't go to Medicare.gov, you can go to Medicare.gov for questions or call 1-800-Medicare, but to sign up for Medicare, you go directly to socialsecurity.gov. Also, this is a great site to just start when you're thinking about retirement. If you have not retired yet, you have to go here and you have to check out what to expect from Social Security. Again, Charlene did a great job of making sure that people understand that they should create the My Social Security account. I'll give you some information right now, but just really quick, Charlene talked about scams, right, with Medicare, and I'm sure you've gotten many calls, whether it's on your home phone, your work phone, or your cell phone about these scams that are going on. People pretending to be federal agents, whether it's from the IRS or from Medicare or Social Security. They're calling and they're threatening you. For one, as a federal agent, I don't call people and threaten them saying that we're going to stop your Social Security number or stop your Social Security benefits unless you give me your personal information, or I'm not going to ask you to buy prepaid gift cards. It sounds silly enough, but a lot of people are doing that. A lot of people are giving up their personal information. They're buying those prepaid gift cards because they're scared. They think that something's going to happen to their Social Security benefits. So please continue to spread the word. This is a scam. This is a huge scam. There's a lot of people losing millions of dollars because of this scam, and report it. The important thing is to hang up and not give up your information or your money, but importantly to report it. Go to oig.ssa.gov so that we can have more information to stop these fraudsters from continuing this information. Charlene again mentioned, and I want to keep mentioning Charlene because it was great to have that information. I was listening. So the Social Security statement is something that we used to send to everybody. You used to get this in the mail 3 months before your birthday, right? It was like clockwork. Every year you used to get this. The agency saves over $11 million by not sending this out anymore. They moved it online, so you create your My Social Security account. And some of you may not even know, are you covered? Do you have enough credits? Did you pay enough into Social Security to get Social Security benefits or Medicare? You look at this statement here, it's revised, it looks a little bit different. It's shorter and it has links. If you were to look at this on your tablet, your laptop, your phone, it has active links that take you back to our website so you can get more information. But this is the document that you need to show you what to expect from Social Security. I know somebody asked a question about disability benefits. Here, if you did work, it's possible that you can be protected for disability benefits. Now, if you are currently protected for disability, it depends on your age, how old you are, how recently you worked. Again, if your disability is going to last for more than a year or result in death. So please make sure you contact Social Security. But this statement is the key to you knowing what to expect from Social Security in the future. Again, now you can check this out at any time if you create your own My Social Security account, and you have to check this early on. Younger generations have to start looking at this now. See what to expect, because it's not as much as you think, right? It's only about 40% of your earnings in retirement. So a lot of people are surprised when they come to that retirement age saying, hey, is this all I'm going to be receiving? Yes. So we have to know that early on. We have to start saving early on. So we have to start looking at this as early as possible. There was already mentioned about Medicare.gov, 1-800-Medicare, or also the State Health Insurance Assistance Program, or SHIP. So great information that was already given. And there's also links that were on here as well. So really great job. Follow us on social media, because we do give out information about Social Security and Medicare and Medicaid. So if you follow us on Facebook and Twitter, there's great information that's on there that has links that go back to our website. Also, there's videos on there where you can find out more information about benefits. Let's say you want to know more about Social Security benefits, including Medicare. You can go to the Facebook section. It's also available in English and in Spanish. There's Facebook videos that are about 45 minutes to an hour long, which gives a detailed explanation of the different types of benefits. We also have a Spanish version of our website, which is segurosocial.gov, but not just English and Spanish, because if you go to the languages section of our website, you also see there's about 15 other languages where there might be publications available in that particular language. So a lot of information to share with a little bit of time. Just to give a little bit more detail on what you can do if you create that My Social Security account is not only can you look at that information, right? Not only can you look at that earning statement, but you can also replace your Social Security card now. You can replace your Medicare card through your My Social Security account. In order to have a My Social Security account, you do have to be at least 18 years old. You have to have your own email address. You have to have your own Social Security number and your own U.S. mailing address. So you have to be over 18 in order. So you don't have to be a U.S. citizen to have this account. But if you want to replace your Social Security card, you do have to be a U.S. citizen. But do yourself a favor. Please create this account today. If you don't already have an account, you do have to sign in with login.gov or id.me. So if you don't have that account, you have to create that. It's an extra level of security, because we don't want just anybody to be able to create this account, right? You have to protect this, because this is your vital Social Security information. So yes, you may or may not be able to create this account. If you're not, you can visit the Social Security office and we will help you establish this account as well. So one more thing I wanted to answer, or two more things, because I am done with the information. It was only a little bit of information, but I did want to answer or give a little bit more information about somebody's question regarding filing for Medicare while they still have health insurance through their employer. You can actually do that. So if you do have health insurance through your employer, you can file for Part A, and you can hold off on the Part B until what Charlene mentioned, the special enrollment period. You can do that, but I would suggest you also check with your employer and see if you do need it. In some cases, with some employers, they might actually pay for your premiums because they might make you file for Medicare if you're eligible. So check with your employer if you do need that, or if you want to hold on and file in the special enrollment period. That's an 8-month window to file under the special enrollment period. So please check with your own health plans, health insurance through your employer, and see if you have to file for Medicare, because you could have both at the same time. But it's up to you and up to your employer if they do need you to do that while you still have health insurance and you're currently employed, or you have health insurance because your spouse is currently employed. So please check with them for that information. One more thing too, I know one person mentioned about selling a house, right? If that will affect your Medicare premiums. It's possible, it may happen because of the what's called the income-related monthly adjustment amount. So Social Security looks at your income, what you reported to the IRS 2 years ago. So what happened 2 years ago may affect your Medicare premium this year. So next year in 2024, Social Security is going to look back to what you reported to the IRS in 2022. If that was, let's say, when you sold a home, you reported that to the IRS, there was higher income that you had in that year, that may affect your Medicare premium for that year, just for that year. So Social Security is always looking back 2 years. You'll get a letter that's in the mail that will tell you what your Medicare premium will be for that year, based on, again, your income for 2 years, 2 years ago. So it can fluctuate. depending on your income. So please use those resources that are available, Medicare.gov, socialsecurity.gov. There's publications that were on there that Atisha did have on the chat, that some of those are Social Security related. So great job with that. Thank you again for this time, for these few minutes to be able to give out information on Social Security's relationship with Medicare. So thank you very much.
This was an excellent presentation. Thank you, Guillermo, for coming in. I'm so glad we at least give you a few minutes to at least say something. And Charlene, you set the pace. You go, girl, as they say. You set the pace, and that's really good. We like to share just a few more resources with you. So for those watching in the Los Angeles area, you're welcome to contact the Center of Health Care Rights, the CHCR, to assist with your own personal Medicare questions. And then also from Social Security Administration, we have an information sheet that would help you find the right department for your questions. So I'm getting ready to close out now, and I'm so glad that everybody is here. Finally, I would like for you to see what our upcoming events is going to be for our coming ups. So our next Tea and Coffee Tuesday monthly meeting will be on Tuesday, October the 10th at 9 a.m. Mark Byer will be back to talk more about plastics and plastic recycling. And we would also like to invite you to our quarterly series, Piggyback Essentials with Martin, on Thursday, October the 26th at 9 a.m. We will be continuing our conversation on the basics of estate planning. Now, if you'd like to see today's program or other past Tea and Coffee Tuesday programs, check them out on our AARPCA YouTube website.